Hello everyone, we completed Unit 1 in which we learn about inclusion, concept, meaning, definition, need and importance of inclusive education, policies, acts, programs of inclusive education and different types of school like inclusive school, integrated school, special school and mainstream school. In this way, we completed our first unit. Today we will start Unit 2, that is Types of Disabilities. Let's see the introduction about this unit. We live in a world full of diversities. Every form of living and non-living being is quite unique and different from each other. At times we lack words to appropriate the unimagined creativity of God when we find that no creation of His is an extra replica of the other. As a result, a child comes to this earth with its own unique abilities and capacities of body and mind. Some are fortunate enough to have extraordinary abilities or capacity, while others are average or even suffer from many deficits and deficiencies, since from the birth, the gap between the abilities and capacities of the children related to their learning, adjustment and development found at the time of their birth may be further be widened by the nature of the environmental differences encountered by them in their nourishment and education. As known already, exceptionality through its wings like positive and negative deviations are quite capable of portraying both the bright and dark perspectives of one's growth and development. With its bright portraying, it brings into limelight the positive exceptionality of our children in the shape of their superior abilities and capabilities, that is, giftedness and creativity. Its dark side portraying focuses on much larger group of exceptional children known as disabled children. These children suffer from many deficiencies, deficits and incapacities in one or the other aspects of their growth and development. As a result, the term like impairment, disabilities and handicap, etc. are often associated with their exceptionalities for understanding and caring for them. So this is all about the introduction of this unit. Let us see the concept of impairment, disability and handicap. According to the International Classification of Impairment, Disability and Handicap, WHO, in 1980 has defined these terms as follows. Impairment is defined as fundamental, structural, psychological or physiological deficit, for example, disordered motor control in cerebral palsy. Disability is defined as the functional deficit that a person experiences interfering with walking. Third one is handicap. It is defined as the disadvantage a person with disability experiences in various societal settings as a result of their disability. Example, people who cannot walk may be denied access of particular places. So, these are the definitions according to who. Let's see one by one. Impairment. Impairment in its simple meaning denotes or represent a sort of disturbances or abnormality in the structure and function of our body system, including psyche. In this way, it represents a certain type of loss of deficit and deficiency at the organic and psychic level of an individual. For example, loss of a limb, paralysis of speech, muscles or leg disturbances in one's vision or hearing system, disturbance and structural abnormalities in one's neurological system, brain, spinal cord, etc. So this is all about the impairment. The term disability is used to mean the loss of function that individual experiences because of the impairment. It limits his ability to perform experiences because of the impairment. The term disability is used to mean The loss of function that individual experiences because of the impairment, it limits his ability to perform certain tasks. For example, vision or hearing impairment may result into one's loss or reduced function with respect to the use of his visionary or hearing system. Another example is orthopedic or motor impairment may limit one's function with regard to one's walking and other motor functioning. When impairment results into a specific type of disability, the disability in its own turn may give birth to a specific condition known as handicap. Actually, a handicap stands for the disadvantage imposed on an individual on account of his disability. For example, some disturbances in the structural composition and functioning of ear may be cause of hearing impairment. This impairment may bring disability in terms of loss of hearing ability, inability or incapacity in terms of hearing sounds, then may turn one into orally handicapped, that is, experiencing problems in interacting with the environmental situations demanding hearing ability on one's part. In this way, the term handicap usually refers to environmental or functional demands placed upon individual with a disability in a given situation. More specifically, a handicap is the effect of a disability on an individual's functioning in his environment. It may limit his social functioning as per limit his social functioning or adjustment to his environment as per limits imposed upon him doing so by his disability of one or the other kinds. As a result, a physically challenged child, even after using wheelchair, may feel handicapped in terms of making proper adjustment and adaptations to his self and environment. He may find his motor disability as a major obstacle in his proper socialization. It may deny him valuable opportunities of entering into the activities and profession of his choice, getting married, and difficulty even performing his day-to-day activities. So, the previous discussion may lead us to conclude that all these three terms, impairment, disability and handicap, have a perfect linear relationship, that is, one leading to the other. Impairment, disability and handicap. So, these are the concept of these three terms, impairment, disability and handicap. Meaning of disability: the condition of being unable to perform a task, function because of a physical or mental impairment, something that disables or handicap. A disability is any condition that makes it more difficult for a person to do certain activities or interact with the world around them. These conditions or impairments may be cognitive, developmental, intellectual, mental, physical, sensory, or a combination of multiple factors. Educators and teachers are rather inconsistent in using terminologies such as impairment, disability and handicap. The terms are used represent children who need special assistance for education. Though limited consideration is given to the general usage of those words, clear distinction is required for academic, professional and skill development purposes. Impairment is basically a medical term but has become an educational term as well as referring to a loss of limb or a faculty. The impairment becomes disability when it is developed to such an extent that the individual cannot fully participate in the social or vocational pursuits. But this condition does not prevent the individual from his or her disabling condition, and through using his or her training is need-based skill to reach the optimum level possible. Societal attitudes make it difficult for this person to function normally even after need-based skill training. So this is all about the meaning and concept of disability. Let us see the definition of disability. A disability is any condition of the body or mind, impairment, that makes it more difficult to the person with the condition to do certain activity limitations. and interact with the world around them. Participation restriction. For example, a child sitting on a wheelchair in the class may not feel handicapped while discussion, but he or she may feel so while doing experiment in the science laboratory and working in a vocational course class. A child, for example, a child with an artificial limb may be feel handicapped while competing against non-disabled peer at the time of playing football or cricket, but may experience no handicap in the classroom. Another example is a blind child may be experience major handicap in a situation where eyesight is most needed, that is traveling in an unfamiliar terrain, but he may also have advantage over sighted person in situation where eyesight is not important, that is singing a song, playing on a musical instrument, etc. So there are many types of disabilities such as those that affects a person's vision, movement, thinking, remembering, learning, communicating, hearing, mental health, social relationships. Let us see the types of disabilities: physical disabilities, sensory disabilities, visual impairment, hearing impairment, olfactory and gustatory impairment, balance disorder, intellectual disability, mental health and emotional disability, developmental disability. These are some types of disability. These are the three causes of disabilities. First one is hereditary factor, second one is congenital factors, third one is an environmental factor. Let us see one by one. First one is hereditary factors. The role of hereditary variables in determining some of personality characteristics as well as behavioral abnormalities and learning disabilities have been established. Even the non-genetic parental influences during the period of pregnancy also contribute to occurrence or aggravation of mental retardation, intellectual impairment, temperamental deficit, learning disabilities like dyslexia and attention deficit hyperactive disorder, and even in autism some role of hereditary factors has been confirmed. Disorders concerning sub-average intellectual functioning such as Down syndromes have been the result of chromosomal or genetic abnormalities. The saying that some unfortunate ones start their journey in life with fewer advantage or greater disadvantage. So these are the three types of causes of disabilities. First one is hereditary factors, second one is congenital factors, third one is environmental factor. We have seen that many of our children lie on the extreme ends of continuum of their individual differences, demonstrating a strong presence of positive, negative and multiple deviations with regard to one or the other aspects of their personality. Now this question arises: what makes them deviate or differ too much from the expected norms in one or the other aspects of the behavior? What are the underlying causes of the disabilities amongst the children? So the answer to these questions lie well in the genetic or hereditary or environmental influences. So first one is hereditary factor. The saying that some unfortunate ones start their journey of life with fewer advantage or greater disadvantages than other, while few others quite fortunate enough begin their journey with greater advantage, clearly point out the role of hereditary contributions in laying the sound foundation stone of the exceptionality visible in the child at their birth or onwards. In their long history, the cases of positive exceptionality in the shape of extraordinary mental capacity and creativity, and negative exceptionality in the shape of familial mental retardation, have been continuously associated with one hereditary endowments. Galton's work under the publication of his Hereditary Genius may be said to be a first such solid testimony in this regard. Similarly, the things like chromosomal anomalies and transfers of defective gene have been well regarded a major contributing factor in causes so much negative disabilities, exceptionalities, conditions in the child since their very conception in the womb of his or her mother. Specifically, the conditions such as Fragile X syndrome, mental retardation, hyperactivity disorder, and dyslexia all seem to have genetic component. Second one is congenital factors. Chromosomal deficits caused by or too many chromosomes. Second one is congenital factors. In that, chromosomal deficits are there which is caused by two or many chromosomes or problems in the structure of chromosome such as Down syndrome and extra copy of chromosomes or sex chromosome abnormalities. A birth defect, also known as the congenital disorder. It is a condition present at the birth regardless of its cause. Birth defects may result in disabilities that may be physical, intellectual or developmental. The disabilities can range from mild to severe. Congenital heart defects are the most common type of birth defects affecting approximately one. Congenital heart defects are the most common type of birth defects. Few examples are Down syndrome, heart conditions, cerebral palsy syndrome, Fragile X syndromes, etc. Let us see the environmental factors. Environmental factors are said to play their role right from the very moment of the conception of the child in the womb of their mothers in the causation of the positive, negative and multiple exceptionality among them. What is available to them from their mothers for their nurturing and well-being during perinatal period, the mental and physical health of the pregnant mother, their exposure to substances and drug abuse, radiation, etc. The unfavorable condition and the factor operating at the time of delivery of the children, what is available to them in the form of postnatal factors after the birth, especially during the first 5 years of the early life, the incidents and the accidents, chronic health problems, infections and diseases encountered by them all go in creating sizable deviations and exceptionalities among them. Environmental determinants start influencing child's development even before he or she come to this world. For example, non-genetic parental influences affecting the development of fetus. Another example is parents working in factories of solvents, paints, air traffic, high jobs, radiation and high power X-rays. These factors generally adversely affect the cognitive development of child. Pregnant mothers' intake of abusive drugs happens to affect the physical development of fetus. Such children when born were having loss of limbs, fixation of limbs at the wrong place or having floating kidneys. So these are the causes of disabilities. Let's move towards the types of disabilities. There are 3 types of disabilities in this course. First one is sensory disabilities, in which hearing and visual impairment we will see in detail. Physical disabilities. In physical disabilities we will see in detail orthopedic impairment and cerebral palsy. In intellectual disabilities we will see in detail about mental retardation, autism and learning disabilities. Let's move towards the sensory disabilities. What are sensory disabilities? Sensory disabilities can involve any of the 5 senses, but educational purposes it generally refers to a disability related to hearing, vision or both hearing and vision. For example, deaf, blindness, deaf and hard of hearing, visual impairment or blindness, etc. Let's see the types of sensory disability: visually impairment and hearing impairment. These are 2 types of sensory disabilities. These are the 2 types of disabilities which we will study in detail First one is visually impairment. Let's see the introduction about the visually impairment. Senses are said to be the gateway to knowledge. Out of our 5 senses organ, the senses of sight possesses the most unique advantage of providing knowledge and information of the environment surrounding us in a most comprehensive and suitable way. That is why knowledge gained through a picture of the object, person or event is said to be 100 times better than its mere description in words, that is hearing about it. In case we can have a living actual experiences of the object or event through direct contact, then the worth of such information and knowledge gained has no parallel to any type of other media to exposure available for its gaining. Now it is no matter of secret that one can avail such experiences only by banking upon his visual abilities. Unfortunately, the child with visual impairment in one way or the other are denied the valuable opportunities of coming into direct contact with the realities of life and environmental surrounding through their senses of sight, and may therefore suffer to the extent requiring special care, provision, education and treatment for their well-being, development and adjustment. According to the federal, a vision impairment is a problem in seeing that even with correction adversely affect a child's educational performance. The phrase does not include people with normal or near normal vision, but does not include people with low visual functioning, partial sight, as well as those who have only light perception or those who are totally without the senses of vision. People with normal or near to normal vision can perform the task without special assistance. People with low vision may have difficulty with detailed visual tasks or may perform them at reduced level of speed, endurance or accuracy even with assistance. These people are referred as a partially sighted people. Who are blind or near blind have unreliable vision and rely primarily or exclusively on other senses. So it is all about the introduction of visually impaired. Understanding the concept of visual impairment. Anatomical changes in the visual organ caused by disease of the eye. Visual impairment refers to the functional loss that results from a visual disorder. Visual disability refers to vision-related changes in the skill and abilities of an individual. It describes the level of performance of a person based on functional vision. Visual handicap refers to the psychosocial and economic consequences of visual loss, such as loss of independence or inability to walk. So this is the concept of visual impairment. Let us see the meaning of visually impaired. Visually impaired children may be defined as those children who suffer from impaired conditions, difficulties and deficiency presents in their visual organs, which make them different from children with normal vision to extent or requiring special education provision. So blindness is central visual acuity. Visual impairment as an umbrella term includes all level of vision loss and thus may represent a continuum from individual with very poor vision to individual who can see light but no shapes to individual who have no perceptions of light at all. As a result of such variance, we may find the use of number of terms interchangeably to describe children with visually impairment, such as visually impaired, visually disabled, visually handicapped, partially sighted children, having low vision, legally blind and totally blind, etc. So this is all about the meaning of visually impaired. Let us see the definition. According to PWD, Person with Disability Act, 1995, blindness refers to a condition where a person suffers from any of the following condition: total absence of sight, visual acuity not exceeding 6 by 60 or 20 by 100, snelling in the better eye which correcting lenses, limitation of the field of vision subtending an angle of 20 degree or worse. So this is all about the definition according to the PWD Act. Let us see the classification of visually impaired, visually handicapped, blind or low vision. Visually handicapped, the total group of children who require special educational provision because of visual problem. So they are visually handicapped. Blind, having either no vision, almost light perception, the ability to tell light from dark but no light projection, the ability to identify the direction from which light comes. So they are blind. Limited distance vision but some useful near vision at a range of several feet. Function varies with light, task and personal characteristic adjustment are possibly necessary in lighting, size of print or objects and distance. So they are low vision. Definition of blindness. WHO, World Health Organization, has classified visual impairment and blindness into various grades: 6 by 6 or 6/16 normal vision, 6 by 18 or 6 by 60 is visually impairment, 6 by 60 or 60 severe visual impairment, or 6 by 60 or NPL is totally blind. So these criteria were given by WHO. What are the causes of visual impairment? Injury to the eyes, inherited condition of blindness and vision impairment, infection of the eyes, diabetic retinopathy, glaucoma, age-related macular degeneration, AIDS-related visual impairment. So the causes regarding the visual impairment and disability of the children lie well within one's hereditary endowment as well as socio-psychological and physical environment. The transfer of gene and chromosome associated with visual impairment to the children from their parents at the time of conception, the careless adopted by the pregnant mother in their diet, malnutrition, use of strong drugs, being affected from chronic diseases and affected with serious accident and incidents, the abnormal and stressful psyche states, unhealthy living and socio-psychological environmental condition faced by the mother during their pregnancy. The mishaps and incidents at the time of birth of the child, premature delivery, effects of anesthetic agents and instrument used in delivery, infection caused to the children during delivery, starvations, malnutritions, unhygienic, congenital and unfavorable conditions faced by the children in their early years, the ill effect of infectious diseases like smallpox, chickenpox and measles, etc. The disease of the eye and infection, the deficiency of vitamins and other nutrition components essential for maintaining health and well-being of the eyes, the evil effect of fatal diseases like cancer, growth of tumors, skin diseases, malaria, typhoid, etc. Improper posture adopted at the workplace and especially at the time of reading and writing, the ill effect of reading, writing and working in the defective and improper light as dim light, moving lights, quite intensive light or fast colored artificial lights, the exposure to electronic devices, radioactive substances and rays, especially watching programs excessively on the TV, computer screens and working with computer have added too many problems and defects of the eye of the children nowadays. The injury and ill effect caused to the eyes with the carelessness adopted in day-to-day functioning as well as in professional activities. the damage of the eye organ and other organ of the body responsible for proper sensational and perceptual activities through fatal accidents, the ill effects of poisoning and intoxicating substance and drug addiction, the ill effect of external objects like dust, smoke and pollution, etc. are the causes of visual impairment. Let us see the identification and assessment. So, there are two types of identification and assessment. So, first one is clinical assessment, second one is functional vision assessment. So, in clinical assessment, by so far the Snellen chart developed by the Herman Snellen, a Dutch ophthalmologist, is the most common visual screening test. By so far the Snellen chart developed by the Herman Snellen, a Dutch ophthalmologist, is the most common visual screening test. It consists of 8 rows of letters for those who can read alphabets ranging from the large to small. E's for those who are illiterate or very young. At the time of eye examination, the child is made to stand 20 feet away from the chart and is asked to read the letters with each eye with the other eye closed. Assessment is based on how accurately the child identifies the letter or direction of the E's. The serious limitation of using Snellen chart lies in the fact that it can be used to screen for distance vision problem only. In case of child suffers from near vision problem, then we need to resort to some other measures preferred in the form of functional vision assessment. So let us see the functional vision assessment. In such type assessment of one's visual problem, attempts are made to assess how well one can use the vision that one possesses. The following types of measures may be adopted for this purpose. First one is assessment based on the visual performance. How well does the child perform on distance vision task? How well does the child perform on near vision task? How well does the child perform in terms of visual field perception and color vision? How well does the child perform in terms of travel skills? What is overall wrong with the child in terms of his visual ability and progress? Second one is assessment based on behavioral system. Does the child rub his eyes excessively? Does the child hold book close to the eye or lean down close to the book? Does the child hold book too far from his eyes? Does the child unable to see distance object that is writing on the blackboard, map, details clearly? Does the child lose place frequently when reading? Does the child blink his eyes more than usual or becomes irritable when doing close work? Does the children often hit against object lying ahead or on the side? Does the child shut or covers one eye, tilts head or push his head forward? Does the child stumble over object or experience difficulty in moving around the classroom? Does the child feel difficulty in reading or doing the tasks which are close to the eyes? Third one is assessment based on the appearance symptoms. Does the child have one eye higher in relation to the other? Does the child have an eye that tends to wander? Are the eyes of the child unable to move smoothly in all directions of the gaze? Does the eye of the child get red frequently? Does the child have crossed eyes? Does the eyes of the child water frequently? Does the child's eye look abnormal, example bulging, too big or too small? Is there swelling in the eyelids of the child? Do the eyes of the child look red, rimmed or uncrusted? Last one is assessment based on self-reporting. Does the child frequently complain of dizziness after reading a passage or completing an assignment involving vision? Does the child frequently complain of headache or eye infection? Does the child complain that his eye get hurt in bright light? Does the child complain that his eye itch, burn or feel scratchy? Does the child complain in perceiving the objects that they look blurred, or he has dual images of a single object? So these are the identification and assessment of vision impairment. Let us see the decision concerning curriculum. Curriculum, as we know, is a guide path filled up with essential learning experiences for attaining the desired teaching learning objectives as needed in the case of a particular group of learner, since the need and requirement of the adjustment and education of the visually disabled are necessarily different and special than those of their non-disabled peers. These children normally require very special consideration in terms of curriculum adaptation. Apparently, in their cases, we can come to the conclusion that in addition to catering their academic needs as per the lines on their peers with normal vision, the curriculum should also provide means and ways for the development of all those concepts and skills which are usually denied to them on account of their loss of vision. Example, communication and listening skill, orientation and mobility skills, daily living and social skills, etc. In this way, the curriculum adaptation for the visually impaired student essentially required enrichments, that is, inclusion of various learning experiences and opportunities for the development of a specific concept and skills critical for their survival and successful living beside the existing core curriculum meant for all children. The elements of such enriched or plus curriculum can be clustered under the following 6 major headings. First one is personal competence, self-adjustment and daily living skills, orientation and mobility, communication skill, listening, speaking, reading and writing, vocational guidance and career development, of special aids and equipment, for example, tape and cassette recorders, record players and talking books, personal computers and typewriters, braille, large type materials, optical aids, electronic reading and writing devices. Last one is vision stimulation, that is maximum utilization of residual vision capacity. So these are the decision concerning curriculum. Let's